What is pulmonary rehab? Basically, it is exercise. We gear it towards the respiratory system. Am I going to build a six-pack abs? No. However, am I going to work on the intercostal muscles, your chest muscles, the diaphragm, anything from the waist up? That's what we're here to focus on. Okay, so that's the biggest thing. You're going to have to flip. I'm sorry. So the pulmonary team, anybody who's done pulmonary knows that it involves a very diverse group of people. You've got your physician, you've got the nutritionists, you've got the pulmonologists, respiratory therapists, you've got the exercise physiologists. Sometimes they even incorporate in a massage therapist because they have found now that that actually works as well. Occupational therapists, sometimes after people have chemo treatments, after people have surgery, they lose some of the dexterity. So you actually may have an occupational therapist on your team as well, but it takes a whole team. So anytime you guys have questions, feel free to sit there and ask. So pulmonary rehab, basically, anybody who has participated, we incorporate stretching. Breathing retraining is what we're going to focus on the most. We work a little bit on our aerobic exercises. We'll talk about what they are.
Right here.
And then strength training. And we do all this, as you know, in a very medically supervised environment. That way, if you have any problems, we've got people there to come. You can go to the gym. They're wonderful. The Y is a place to transition to. The questions you want to make sure of once you finish. Do they have staff there 24/7 so you're not exercising? Do they have AEDs available in case you have trouble? And does the staff know how to use the AED if there is any trouble? So those automatic external defibrillators. So if you're in pulmonary rehab, I have access to a protocol. I have physicians. If you're at the Y or you're at a gym and you're exercising, more and more people are adding those AEDs or the automatic external defibrillators. You know, you hear about all the basketball players in the high schools now. You know, they're able to save lives because the sooner you use that, wherever you exercise, make sure they've got it and staff knows how to use it. Each person's very unique. Everybody's got a different background, a different diagnosis. So we actually work with the team to make sure that we coordinate everything for you. So it's very tailored to each individual person. Some of the components about respiratory pulmonary rehab, the first thing that we're going to do is we're going to do an initial assessment. We want to make sure that you're going to have to click again. I didn't click it, did I? So initial assessment, we want to make sure it's safe for you to come in and exercise. Okay. Some doctors like you to come in and prehab, get strong for your surgeries, get strong for your treatments. Other doctors want you to come in after your surgeries. Some people are just very deconditioned. Some people are very short of breath. There's multiple reasons. So we want to make sure it's safe. The next thing then we want to do is we want to do supervised exercise activity, which we talked about. Next, we're going to do our functional and ADL training. ADLs, that's our what we call activities of daily living. This is getting up, getting dressed. How do I not get short of breath when I take a shower? How do I do my grocery shopping? So we really focus on all that, if that makes sense. Then energy conservation will be next. How do I get through the day? We all know we've got bad days, and how can I do these? I've got a busy week. The next thing we're going to focus on, which to me is the most important thing, breathing retraining. If you know how to breathe, then everything above it will come in time, if that makes sense. And there is a right way and a wrong way to do it. Stress management, as we all know, is very important. We're going through a very stressful thing. We want to make sure we've got support. How can I not panic? So we incorporate a little bit of that into our education as well. And then last but not least, we've got medication education. So medications, make sure everything interacts. We could do a whole nother topic just on medications. Each of these is like a whole education system by itself. But the biggest thing on medications is make sure your treatment teams knows what you're taking. A lot of people buy herbals. A lot of people use over-the-counter medications. These things can interfere with you. They can interfere with your treatment program. People may not think, oh, well, I'm taking elderberry. Or I'm taking the extra zinc today. Well, guess what? It makes a difference. So be honest with them. If they ask you today, are you taking anything new? And your best friend said, well, I take a zinc every day. I take a vitamin D and echinacea every day. Let them know. These are over the counter and it can interfere with your other medications without you even being aware. All right, next slide then. We're going to talk about, this just shows the dynamic. It doesn't replace any therapy. It just shows another team where we're all working together. One thing goes to the next. The goal is to optimize you. Am I going to cure you? No. Can I help you have a better quality of life? Absolutely. That is our goal, is to have the best quality of life, to do the things that we want to do when we want to do it. Correct? Everybody agree? All right. So pulmonary has many benefits. It can improve your brain function. We'll talk about that shortly. It can improve the quality of life that we talked about. Breathing symptoms is the biggest. I'm sorry, I'm down here. It's hard. I'll try to slip. Breathing symptoms are the biggest thing. Optimizing for surgery, we already talked about. Even if you've got advanced lung disease, that's probably my salad, isn't it?
I don't know who's who.
Thank you so much.
Sorry.
I'll eat that later. Perfect.
Perfect.
But the biggest thing is you can still benefit from pulmonary rehab. And then the most important aspect, some of our patients say, is the emotional and the support group. You're with other people that are going through the same thing that you are. It's hard when you don't have that good support system. This is actually a picture of a lung cast that you're looking at. And I love this as an example. It's hard to see, I'm sorry. But if you really look at it, it shows you how it looks like an inverted tree. So you see how you've got the trunk. When the different one, we'll go into a little bit of anatomy here in a minute. But where your breathing and your oxygen takes place is all the way out at the end, what we call the alveoli, which would be the equivalent of the leaves of the tree. But this is actually a real cast.
You see our logo, the tree with the leaves on it.
Oh, cool. So it's the same.
Like lungs.
Perfect. So do you need pulmonary rehab? I'm trying to click with you as we
Do you
go.
need a doctor to prescribe
Yes,
pulmonary rehab?
yes, we do.
Am I jumping ahead? I'm sorry.
No, that's perfect. Anytime, please. This is very informative. I'm all about questions. If we go here 2 hours, we'll go 2 hours. But basically, if you've got questions about oxygen, medication, you're short of breath, like I already talked about, are you having surgery? Have you just finished having surgery? Those are the types of things. The next slide, it will sit there and you beat me to the punch. Yes, you've got shortness of breath. It's hard to do things, showering, okay? That person's exhausted. They've tried to do everything at once. And I don't know whether or not you got to see the little guy. But, if you're not enjoying the activities that you did prior to our event, then we need to let our doctors know, okay? And let's get it. There's a lot of programs out there that are different. Next thing is going to be getting started. Yes, if your physician feels that you are a candidate for pulmonary rehab, at that point, they will go ahead and put in a referral. If and but you feel like you're deconditioned, you need to be honest with your physician. They're there for you, and they're there to help you. Ask them, what do you think? Now, are they going to know what the activities are? No, they don't know what I do. Just the same that I don't know what they do. But we work together as that dynamic team to make sure that we're meeting each individual person's
Kim,
needs.
is this a one and done thing? Because I had it when I very first had my surgeries 17 years ago, and I wasn't ready to absorb all of that right then. And I could really benefit from it now, I think.
As long as you've got, and this is where it gets really tricky because the insurance keeps changing over and over and over again. As long as you've got a diagnosis that the insurance company would cover You may come as often as you want. Anybody that has if you just have shortness of breath, as we go down the road, are we going to go into different lung conditions? COVID has been huge and it's taken a big hit, but we don't know where we're going. So a lot of people, maybe 5 years from now, they're going to hear this big word of interstitial lung disease, pulmonary fibrosis. Radiation can cause other lung conditions down the road because we're right here, the heart, just like breast cancer.
Probably
radiation.
COVID too will cause lung cancer.
COVID is going to be eventually interstitial lung disease and fibrosis, where the lungs just get still. Any of those are qualifying diagnoses. Do I want you to come in right after surgery? No. You will not get the full benefit. Our educational component, I used to teach 30 to 45 minutes every week where I was, and you came for 12 weeks. That's a lot of education. Every topic we talked about, and we drove it down. If you can't absorb and you cannot exercise, you want every visit to count. Can you come back? Absolutely. So, does that answer everybody's question? You have a lot of muscle weakness, chemo and radiation. We're in this area. So the muscles get weak. You're sick. You don't feel good. It's an old adage, 2 days in bed takes you 3 days to get over. So you're talking 6 days. So, all right, anatomy of the respiratory system. So this is kind of cool. And I don't know how much your doctors will talk to you and how much of this you've heard before, but I'm a very firm believer of you need to know what they're talking about. So you've got the right lung, it's divided into 3 lobes. You've got your upper, you've got your middle, you've got your inferior. You've got the left lobe that's divided into 2 lobes. So if you look at the difference, what do you think fits there in the middle? And why your left lobe would only have 2 lobes? The heart. That's exactly right. So the heart and the lungs, they work together. And that's why we refer to it as the cardiopulmonary system. When one starts going bad, the other one will eventually follow because they support each other. Down below, you see you've got your throat here at the top. So all this is starting. You go into the trachea. There's little rings of cartilage around the trachea. That's what supports it. And that's why you've got protection. Then you go down and you go into the bronchi. Remember, those are going to be the bigger little branches going out to the leaves. So it is a very complex system. You hear people having pneumonias. We tend to see more white lobe pneumonias, especially in people undergoing cancer treatments because you're nauseated. You end up getting acid reflux. The right lobe or the right side, there's just the path of least resistance is there. If you look, the right sits just a little bit higher than that left side where it splits and bifurcates right there. So of course, the right sits a little higher and you're going to probably wind up with a right pneumonia in the right side or the right lower lobe is very common. Has anybody heard the doctors talk about that? Mm-hmm. Okay. The same thing is if you're having radiation, if you're having surgery, they're going to break it down. Well, we found it in the left upper lobe or the right upper lobe. So this is where understanding the anatomy helps you tremendously. Okay, I told you we were to focus on breathing a lot. Okay, if we can't breathe, nothing else matters. So you're going to breathe in, the chest expands. When we inhale, correct, the diaphragm goes down, which actually pulls the air in through the nares and down through the trachea and into the lungs. When you exhale, everything contracts. You're pushing the air out. The proper way to breathe is in through our nose and out through our lips. The nose has got a purpose. It's here to warm, filter, and humidify the air. Masks have done wonders for us, because it's automatically warming that air when you're walking. So if you're wearing it outside in the winter, me being an asthmatic, I have very few flavors because cold is one of the things that triggers me. I could tell you the minute I got out of my car if I forgot to put my mask on. And I put it on and I was much better. I had no flares. So, but you can tell the difference, right? It's pollen season, I've always worn a mask if I'm mowing the yard because it sets my asthma out. So I'm very comfortable wearing a mask. So, next thing we've got airway and breathing. So we kind of talked about this and I got ahead of myself and I'm really sorry. But you breathe in the air, it comes down through the windpipes into the trachea. Then it goes down into the bronchi. And then it goes out to that little working parts of the lungs that we talked about, which were the leaves of the tree, which were the alveoli. That is where the gas exchange takes place. How many of you have a pulse ox?
Of what?
A pulse ox, that little thing you put on your finger.
You don't have one, Pam?
It's the best investment you can ever buy, and look for them. I got mine on sale at Walgreens for $39.99 when they put them on sale. They're wonderful. It monitors your heart rate. It monitors your oxygenation status. If and but your numbers start to go low, that's letting you know, I need to take some deep breaths. If they go low and they stay there, that's a red flag. So it's wonderful to check. You're always going to be a little bit low in the morning when you wake up because your lungs kind of are waking up as well. So the mechanics of breathing is next. And this just shows, and I hope everybody can see this, but that's your diaphragm. The diaphragm is the largest muscle of respiration. This is what we work on. We test this when you come in, we measure it. We measure it when you discharge after your visits. And most people have got a lot of strength. This is very important for people that are going in pre-surgery. We need to optimize these muscles. You've got to be strong enough after surgery to generate those costs. You know, depending on who's doing your surgery, some go from the front, some go from the back. You know, they're getting better now with microscopic. They can just go in, 2 little holes. They can do what they need to do, and you go on. So, but we want you to be optimized with these muscles. So breathing exercises, I gave everybody a handout. I'll send it to you and you can maybe share it with Lynn.
Sure.
And then they can post it and then if people can print them off if they would like. So people with lung cancer experience shortness of breath and have difficulty breathing, which we know keeps us from being active, correct? So restoring the breathing can help improve, as we talked, is kind of redundant. This is what I'm going to focus on tonight. So the next slide kind of shows you, and I love this slide. I hope everybody appreciates it. There's a right way to breathe and a wrong way to breathe. Yes, we can teach old dogs new tricks. Okay. It is one of those things, it takes practice, and it takes practice in your part. Okay. The masks make it really easy when you're not breathing correctly because you're sucking mask in. When you're walking, I shouldn't see that. So I'll say, hey, you're sucking mask, and they know, oh, I'm forgetting I need to exhale through my mouth. Versus, you know, all right. So the next one, we've got pursed lip breathing. Pursed lip breathing improves ventilation. It releases the trapped air in our lungs. When we can't breathe, we panic. So I bought some tools, and if it's okay, I'll hand them out.
Sure. People are still eating, but it's okay. We'll work with it.
Well, they can do this at home.
Okay, good. Do it at home.
So take straws. And what I like to do is tell people, you know, when you're out with your friends and you're with your family and you are shopping and you have to sit down and they don't understand. There you go. And then I forgot to bring gloves. You tell them that they're breathing through a straw, bigger diameter. When we start air trapping and everything, we feel like we are breathing out of a coffee stir. Big difference. Correct? This is how you educate your friends. This is how you educate your family members. This is me right now. Let them try and let them understand. Your family wants to help. So do your friends. They just don't know. Once they know how you are experiencing with your breathing and how short of breath you are, they're going to get a better understanding of, I need to be, try it at home. Just wash off these ends. I forgot to bring gloves. There you go. There's extras. I'll just put these on the table. Any questions so far? I mean, we all know we have breathing troubles, right? But our family members, it's difficult. So that's something you guys can all try at home to help with your families. The other thing I like to use to demonstrate to my family is a balloon. Okay. What is air trapping? You can do this with a balloon. You can do this with a glass of water. If I took that bottle of water and I dumped it all out, that is a complete exhalation, correct? I've gotten all the air out.
Right.
Now, what happens if I start getting very busy and I'm not focusing on my breathing? I transition from my pursed lip breathing, all of a sudden I'm going, everybody's been there, right? Everybody's done it. It's what we call air trapping. So now all of a sudden, I'm only dumping out half of this water. That's all I'm exhaling. Am I going to be able to take that full breath in next time? No, because you've got air. The lungs already there. You have not exhaled completely. This is where people get into trouble. Stop, focus. We'll go through a couple more breathing exercises. Shut your eyes. Just focus on your breathing. Okay. Try to get that full breath. Same thing with the balloon. Okay. This is why straw is good. There's coffee stirrers. It helps you get the air out and focus. Balloon, same thing. Okay, these are little bitty ones, and I tried to do these at work today, and it did not do very well. But it would be the same thing. If I didn't let all the air out, am I going to be able to fill it up? No. You're not going to get air into your lungs. You're going to panic. This is where people get into trouble. Does everybody have an inhaler, a rescue inhaler?
Yes.
Does everybody have it on their person right now?
Yes. Yeah.
Got it in my purse.
My
Okay.
purse.
You don't have one?
No. I asked him about one, he said,
Some people benefit from them. If you have pulmonary function tests, they can tell if you get a benefit from this or not. If you're not showing any benefit, I like it. It does for me. It does increase your heart rate. Some people abuse these, but it does help open you up a little bit. So ask them again if you ever get to the point where you feel like you need it. Most of the time when people really do these breathing exercises and master this, they're pretty okay. So any other questions about that? Everybody good? This is just the next slide, kind of does
Can I
that.
ask a question?
Yes,
Talking about the inhaler, right?
yes,
So in my case, I cough.
yes.
And then once I use the inhaler and I do it 2 times, and I have to really focus till I got it right. You know, that you're breathing it in right and then you're exhaling it right. So I don't understand, like, what is purpose of? Like for me, it's coughing. Is everybody like that?
Everybody has a different trigger. Mine can be coughing as well,
Okay.
okay? But basically, it's a bronchodilator. They work pretty fast. I've actually seen some people do these and they cough the medicine back out. So do you have what they call a spacer to go with yours? You put this in something, it's like a little tube.
No, looks like double.
Looks just like this.
Yeah, just.
So you want to be real careful with these. And like I say, we can go off the subject and this is a whole different thing. But this comes out at 60 miles an hour. When you spray this, so just be careful. You tip your head up a little bit and you angle it so that it's not going to get caught in the back of your throat. You want it to get to the lungs. And its timing is hard. Right? And then you want to hold it for about 15 to 20 seconds. Wait a minute and then repeat it. Don't ever just go. Okay.
Well, excuse me, but sometimes when everything just, it's like seized up and I can't breathe in or out.
That's when people panic.
I do panic.
Correct.
It's terrifying.
It's very terrifying. And depending on why you are through here, I just shut my eyes for a minute. I bend over And this is what I do, because when I go, I can crash bad. I just kind of bend over, I take my good deep breaths in. Okay, get the air out, and then try to take one. Wait a minute, go back forward. I've used up to 6 of these at a time. Now, this is me, and I know my body, and I've discussed it with my physician. Can I prescribe this to you? No. But this is our game plan. If I don't start turning myself, then, but that's why you want to take one. You want to wait a minute or 2 minutes. See if it helps open you up so the next one's going to get deeper into your lungs. Is this for upper airway obstruction? No. That's a whole different drug. This is to get down into the lungs to open you up. Okay. You start getting up here, then that's upper airway, and that's a whole different drug. That's where you have to go to the emergency room to be treated. So, any questions about that? Any clarifications?
No, but I'll probably ask you to like look at me and see how I'm doing it.
Absolutely.
Maybe I'm not doing it right.
And we've got a doctor who can get you one of those spacers. You just let him know the next time you go. I said you need it.
How about a flutter?
Flutter valve is for airway clearance. Great option for airway clearance. Flutter valves are wonderful. You okay?
Excuse me. Yeah, I'm okay. I'm talking.
So one thing we talk about with breathing, and one thing we talk about with our energy conservation is we do not talk when we eat. We need to focus on our, it's coming up in a slide. So you get it there. Okay.
What's a flutter valve?
So a flutter valve is an airway clearance device. And basically they've got an aerobic out, they've got a flutter valve device, and it's something that you place in your mouth when you take a deep breath in. As you exhale through you don't open it, you just keep it tight. As you exhale, you're breathing against resistance. So you remember when you had children and they were sick and you did a little airway clearance? If you place your hand on the chest with these different devices, you should feel the vibration. That way then, and this is something that just helps get those secretions knocked loose and get them off.
I use it twice a day, and I do 9 breaths
Good,
on it,
good.
and it's really helped.
And it does. They're wonderful devices. And some people will actually take 2 puffs of albuterol to help open them up to maximize secretions. Make sure you're using it right. Make sure you're cleaning it correctly. I've seen a lot of people come in with really bad lung infections because they did not clean their equipment.
Yeah.
Don't ever use well water to clean your equipment. I know this is not what we're really here for, but as we're going off subject. So don't get off from the well water. Well water, you don't know what's growing in it. You can contaminate yourself again. CPAP machines, cleaning the flutters, the devices, no well water, Boston water or whatever. Okay, so next we're going to talk a little bit about what our personal breathing is. So if we all sit here together with this slide here, did I go back? I don't know how to go back. Does it say back? Is that back?
You want to go over there and just tell me to,
I've got it right there, I think. Where did I go back? Anyway, we have to get back there. Y'all got the brochure. You got the handout I just gave you, correct? So we got it. So personal breathing is something that we want to do. This thing's going crazy. I don't even know what slide I'm on, Rusty.
it's okay. I mean, we're okay over here.
Okay, so this is the technique. This is in your brochure that I gave you. Everybody needs to use this. So if we sit here together as a group, okay, relax your shoulders, roll, okay, just like it says. And then we want to take a good deep breath into our nose. Just hold it. 1, 2, 3. And then you want to pucker your lips and you want to exhale. Okay. Depending on your disease process, some people don't get a lot of air in and they've got a short exhalation. Other people can take a short breath in and they're going all the time. Okay, they can get out a lot. The normal ratio is you breathe in on 1, 2, exhale 1, 2, 3, 4. You may be a 1 to 3 person. Inhale, exhale. Okay? But you always want to exhale twice as long as what you inhale. Does that make sense?
Yeah.
Are you going to air trap? That's when you start guppy breathing, you've gotten too far. Okay, now we have to sit down. We really need to relax. We need to bring ourselves to baseline. All right. The next one is pursed lip breathing. I love this little lady. Okay, this is how you should look. Practice it in front of a mirror if this is what you need to do. It is the best way to slow your breathing down. It is a wonderful relaxation technique. If you watch people doing yoga, you know how they sit there and they go, they're kind of doing the same technique. Okay?
I thought that, I was wondering about that, because they say to help the breathing.
Correct.
Yeah.
It's a great relaxation technique. Okay, next, best way to do it is by thinking, smell the flowers, blow out the candles. Okay, not like it's an emergency, but slow and easy. Okay, you don't want to disperse. Okay, you're going to air trap again. Now, what should I use this technique? This technique is something that practice makes perfect. You can teach old dogs new tricks. Going up the stairs, bending over, getting out of our chairs, getting off the toilet, getting out of the car. So what I would do if I'm in this chair, I'm going to sit here. I'm going to take a deep breath in. As I start to stand is when I'm going to start to exhale. Everybody get up that way?
No. Never.
Never. This is where people hold their breath. You're air trapping. Okay? Now, I know we've got food and I know we've got a room full of people, but this is something everybody can do all over. So just sit there for a minute, take a deep breath in. As you start to stand, exhale. Okay? Does that make it easier to stand up? Getting out of your car is a 2-step process. You're driving down the road, you're parked. I'm going to inhale. As I start to slide around, I'm exhaling. Getting my feet on the ground. If you've got leather seats, that's very easy to do. Does everybody agree?
Yeah.
If I've got cloth seats, take a garbage bag and put it on there, a silk pillowcase. I gave a patient wee-wee pads. You know how they're white on one side and they're blue on the other? We put them together with the white hitting each other, and the blue allowed him, it was a game changer for him. It changed his whole life. Now, my feet are outside of the car. What I'm going to do now, I'm going to do it again. I'm going to inhale and I'm going to exhale as I stand up. If you've got oxygen, it's going to be your third breath, because now I'm having to bend down, pick it up, and as I'm starting to pick it, now I'm exhaling for the third time. It is not hold my breath and go, I'm done. Okay? You can't do it. None of us can do it. Make sense?
Yes.
Okay. Any questions? Okay. So her slide, I need to change, and she just left, and I don't know where her little thing is. Ha. So I've got whistles for everybody. Remind me and I'll give them to you. I understand there's a kazoo club somewhere. The kazoo club is a wonderful thing. It teaches you to inhale through your nose, exhale through your mouth. Go to the Dollar Tree, get bubbles. They're wonderful. Inhale through my nose and blow bubbles. Okay? Whistles, I'll give you. The other thing that is wonderful is the pinwheel. Okay? They make big ones. I can't do it. I can do the baby ones. I'm going to inhale. Okay? Anything that's gonna help you see what you're doing. Because if this isn't moving, it's going somewhere else. You're not
Right.
puckering enough. Everybody agree? Okay. So I'll give you the whistles before we go. All right, the next thing we're gonna do and talk about, these kind of go hand in hand. I'm really short of breath. I'm really panicked. We want to use what we call diaphragmatic breathing, okay? Diaphragmatic breathing is just what it is. We saw where the diaphragm is down here. It's the muscle between the lungs and your abdomen. So it's kind of right about here. This is one of the muscles that we work on if you're weak when you come in. Because of the fact of you've got to have to cough. This is where you're coughing from. Okay. After surgery, they want you to cough, right? Everybody knows that. They want you to cough, take deep breaths.
Hello.
Put a pillow, correct. They want you to use the insensitive which I brought. So all those tools are why we want to strengthen these muscles. Okay, this can help reduce you if you become short of breath. So again, we are going to go and we see the muscle again. So you see how it works hand on hand? It goes down, it's pulling the air in. As it comes up, it's pushing the air out. And we know it's located right here where the diaphragm is, correct? So to practice our diaphragmatic breathing, and this is also in the handouts that I'm giving you, practice makes perfect. Find a nice place where you can sit down and work on this. Sit back in your chairs, okay? We've got our chest here. Now, when you practice this for the first time when you lay in the bed, it's easy. Just put something here. I don't want to breathe from my chest. I want to come down to the abdomen, okay? Put your hand here, okay? Slow and easy. Breathe, but focus getting down here. I guarantee you people are going to breathe from here, okay? Inhale from down here. Like you're filling up the tire with air, right? Now, we're going to have a flat tire. Puckering your lips and you're exhaling. This is going to strengthen this muscle that is so very important for people undergoing chemo, surgery, any of that. Biggest muscle of respiration. So just practice. Do I want my belly to go in? No, because now I can't do anything. So just think about a flat tire and a full tire. It's right there in the tire area, right? Fill the tire up. Exhale, putting it down. Any questions about diaphragmatic breathing? It's a great way to reduce your stress, which we talked about. You need to do this when you clear your secretions. So, very important. All right, next. Breathing and energy conservation. And if I'm going too long, tell me and I'll stop. Okay, so coordinate your breathing with all activities as we just talked about. We talked about inhaling when the exhale standing up, doing it in the shower, correct? Same thing off the toilet, out of the car. Talking, eating, laughing, coughing, interrupt that breathing pattern. So when I'm going shopping with my family and my friends, do I want to talk? No. Because what are you going to do? You're going to start trapping some air. If you eat when you talk, it's going to go down here. It's going to go into the belly. The belly's going to get big. Is that diaphragm going to have room to go? No, because your spare tire's there now, correct? This is another reason you don't want to drink carbonated beverages. They blow you up. Like I say, nutrition is a whole different gamut. But there's a lot of gas-eating food, gas-forming foods out there that I adore, but I have to pay for it dearly the next day. Okay? And it goes right here. It blows you up. So, you know, if you're going to have it, make it over the course of the day versus sitting down and, spread them out. You know, nutrition we'll get to here in a minute. And I'm going to touch on it just real briefly. So energy conservation, you've got the lungs that supply the energy, correct? Or the oxygen. And then you've got the muscles that are demanding all the oxygen. So finding that balance, okay, of how, and this is where the pulse ox comes into play. when you're exercising, the muscles are gonna take a lot of oxygen. So put your pulse ox on, see where you are. This is probably where 90% of my patients have to have oxygen. Am I okay sitting in the chair? Yes. Am I okay walking to the bathroom? Yes. But going to the grocery store, walking for a long period of time, I need to have my oxygen on. Next thing we've got, pacing. Why is pacing very important? This is the other hard thing for me to teach people. It gives us time to do things that we want to do. Plan activities that you want to do around your best time of day. Don't let people push you into doing something that you want. Okay, when we call to schedule our patients, I'll say, what's your best time of day? If I've got a really bad COPD patient, they've got to get up in the morning. It takes them 3 hours to do their treatments and clear the secretions. Do they need to be in there at 8:30 in the morning? No. Their best time of day is in the afternoon. As we start going into warmer weather, most of us with lung disease do not do well in the heat of the day. So do I want to go early? Yes, I do. I'll take that 9 o'clock appointment so I can be home before noon. Correct? Go what's best for you. Do not overschedule yourself. Plan rest breaks. This is something that we're not used to do. It's going to give you a better quality of life. Get your 6 to 8 hours of sleep every night. Don't try to cheat and stay up late one night. You're going to pay for it dearly down the road. You know you're going to be up for New Year's or you've got family coming in, then go ahead and take an afternoon nap. There's nothing wrong with that. You want to enjoy your family. We want you to enjoy your family. And then, you know, I just said if we've got the nap, go ahead. So, remembering the race between the tortoise and the hare, they finished. Correct. This is the hardest thing to teach people. We all have lived lives that we've hustled and bustled, okay? Slowing down has been very hard for everybody. Think of yourself as a turtle. It's a snail. You're walking at a snail's pace now, but you're gonna actually conserve a lot of energy by doing this. If we were to go out here and walk in the hall, the person that's walking the slowest would probably be able to walk 5 laps. Somebody going back and forth would probably get through 3. I actually teach my patients to pace. I bought a metronome. You remember in school when we had the music, that constant, I can set a pace, it slows them down. So if you are a fast walker, a fast talker, a fast eater, concentrate on slowing down. Okay? It conserves a lot of energy. So pacing.
Concentrating on that all day, every day. I can't slow down.
You're from the north, right?
I just can't.
And that's that pace they do.
And my husband says you're retired. I'm like, yeah.
But that's just it. You know, we all led busy lives before we retired. This is the hardest thing. And like I say, some patients, I have to put the metronome on them. It's the only way I can slow them down.
Is how?
Put that metronome on them. And you can go on Amazon. I think they're like $8.
Okay.
And you just click it here and set it for about 60 to 70 beats a minute.
Okay.
And it will do like this. Don't do a double tap. But if you focus on slowing down, you're going to be further ahead. So pace yourself. You want to use your breathing as you're doing this, okay? So when you're breathing, think about raising my leg. I'm inhaling. And as I'm walking, I'm exhaling through a couple of steps. And then I'm inhaling again. That's how we were taught in band, okay? So next thing we've got is stretching. Very, very vital component of rehab. Why do we need to stretch? Okay. It's going to improve our circulation. It improves the blood flow, not only to the brain, but to all the tissues. You want to have good blood flow. You know, if you're still smoking, a lot of surgeons do not do surgery because it impedes the oxygen, and your surgical sites need to have all the oxygen that they can get. Hence the reason you hear people going into hyperbaric oxygen chambers to get that 100% oxygen. Okay. It improves the elasticity here. It decreases body stiffness. Now, anybody that's been under radiation and chemo treatment, you know we get stiff, period. Then you start adding old age, you start adding arthritis to the deal. It's not a good picture at all. So just sitting in your chair and stretching is something that's simple and easy that you can do, correct? Think about your neck going down. Look at the ceiling. Once all this starts atrophying or starts getting stiff, that's when you see people walking around, they can't turn their heads. So we want to do it every day. It doesn't have to be all day. Just when you're in the car, look up. When you're in the bathroom, look side to side, that type of thing. It breaks down scar tissue, believe it or not, and it really does help your body repair itself. So aerobic exercises. I know, I love my little brain on the treadmill, okay? It strengthens the heart. It's a brain because it improves blood flow to your brain. It helps improve your memory tremendously. It improves your oxygen capacity. When you're exercising, you need to be thinking about that breathing in through my nose, out through my mouth, right? And getting down the diaphragm. If you can get that, and it takes a lot of practice, trust me, it's not going to happen overnight. And it looks like you guys have a great support group. But aerobic exercise will actually strengthen your immune system. I saw a good article the other day. I want to go back and read, but it was talking about how you get those little round trampolines that you can put in your house and just jump up and down. And they were talking about for people with cancer that it's really good for the lymphatic system. It was a study that just got published. I want to do more research and then maybe I'll send you the link because that's something you can put in your house very easily. It has little bitty trampolines, you know, and just exercise. So some examples of our aerobic exercises. Well, that's why you can buy one now that's got the little handrail around the top of it that you can hold on to when you jump. Have you seen those? No, it's got a little handrail around it so you can hold on to it. So examples of aerobic exercises are activities that increase your heart rate. So we had a big discussion at work because I've got down at the bottom gardening and heavy cleaning. And I challenged him. I said, look it up. It's an aerobic exercise. Yes, gardening is an aerobic exercise. You're using your muscles. You're bending over. That's when you need to focus on your breathing more than anything as well. Because everybody knows, bending over, we get short of breath, correct? So think about how you're bending over. I'm going to inhale. I'm going to exhale. I'm going to do my little digging. I'm going to inhale as I'm getting ready to come up. And I'm going to exhale as I'm coming up. Two-step process. Do you want to hold your breath when you bend over? No. So think about what you're going to do, just like you plan your day, plan how you're going to breathe through that activity. Picking up your laundry basket, another thing. Okay? I'm going to inhale, bend over, get my basket. As I'm exhaling, as I'm going down, I'm going to pick up my basket, inhale. I'm going to exhale coming up. Anybody that's got a rollator, they're wonderful. I can put my basket on that and I don't have to bend over anymore. Anybody that goes to the Dollar Tree, you can find those little grabber things for $1 sometimes. Let it do the work for you. Let it pick something up off the floor for you. Okay? That's how we conserve our energy so that I can enjoy my family when they come tonight for dinner. So how do I get started? We want to do slow and easy. Remember, pacing, pacing, pacing. You can start building yourself up by simply walking around your house. Okay? Some people count steps. It's 900 steps around my house. Okay? Tomorrow or next week, let's try to up it and go to 1,200 steps. Is that a lot? For some people, it might be. So back down, and let's just go to 1,000 steps. But go slowly. Next week, let's add another 100 steps. The following week, let's add another 100. If you go to your mailbox, have a chair in between. You may not make it down and back. Take a break halfway down, go to the mailbox, take a break halfway back, Next time, you might be able to move the chair a little bit further. That's why rollators are nice as well. Because if you are walking, you've got a seat right there. You can sit down at any point. I can give this up one day. But even if you get sick with the flu, COVID, look at all the people that were bedridden with COVID and just got so deconditioned so quickly. It happens to all of us, and we all have one common thing: shortness of breath, no energy, right? So start small. If you're walking through the house, you can get those little hand weights to add as you're walking. If you really want to get industrious, you can get ankle weights. But there again, make sure your team says you're ready. Depending on when your surgery was and how invasive it was, they may not want you doing any heavy lifting. And this is why pulmonary rehab, we work together as a team. I'll shoot that doctor one out really fast. I had a patient the other day, they're waiting to go to surgery. I sent a note to the doctor, let him know where she is. He wants her to finish before she goes. We're quite not there yet, if that makes sense. This is where that communication. You might be ready, and you'll tell your doctor, oh, I'm ready. But from a medical standpoint and a medical staff watching you, you may not be. All right, strength training. So we just talked a little bit about making sure that the doctor knows that you're ready. People with lung cancer can benefit from strength training. It actually strengthens these muscles that are weakened by the chemo and the radiation therapy. It will increase that muscle mass that we lose by laying and sitting around. We talked earlier, 2 days in bed takes you 3 days to get over, so it's 6 days. If you're not feeling well and you're not moving, you can go and buy a water bottle. This probably weighs a half a pound. The big 16 ounces weigh a pound. I can sit here and do this all day long. Okay? At least it's something, right? You can buy weights. They're pretty cheap. I'm sitting in the chair. I can still do something. You want to keep moving. Go out. Has everybody seen the resistance bands? Does everybody have a resistance band? Do you still use the resistance band? Use it. It's a wonderful tool. It will keep all these muscles good and strong. Tie it around your legs. It's great. It keeps all these muscles here when you open your legs. You'll feel all this strengthen up. Put it below your feet. Getting dressed. People get very short of breath. Bend over. Okay? And as you get ready to pull up with the resistance band, it's like pulling up your pants, right? I'm exhaling. Correct? I'm inhaling going down. I'm exhaling as I'm pulling my pants up. Good thing? Okay. Now, I think I missed one. So remember pacing. When a healthy person, our normal goal is 150 minutes of aerobic exercise, strength training a week. We're not there. I'm only half healthy. Okay. So my goal is if I can get 10 minutes 2 or 3 times a day, that's 30 minutes. At the end of the week, I've got my 150. Can I do 30 minutes at one time? Probably not. Okay, especially the hotter it gets. I'm doomed. I have to stay inside my house. Okay. Any questions? Keep it simple. So this morning, we might start with some stretching. Midday, we might do some aerobic activity. And at night, when I'm really tired, I might force myself to do that strength training. Right? Not a good way of doing it. Okay. And then the biggest thing is, as we talked about, progress slowly and make sure you listen to your body. Your body's going to tell you the most. Correct. Exhale with exertion. I cannot preach this enough. This is the best slide. Remember, exhale is EX, exertion is EX. Exhale with exertion. If you master that skill, you will be so much better. All right, next. Okay, we got the brain. We have all these cravings. Okay, everybody goes through chemo and radiation different. If you're on steroids and you've been on steroids, we all know that if you put a lock on the refrigerator, we're still going to find a way to get food. It's just going to happen, right? Yeah, there's nothing we can do. And unfortunately, we crave all the bad stuff. Nothing we can do. It comes from the brain. So nutrition for the lung cancer patients or any patient, okay? You want to make sure that we talked like earlier, There's no special diets out there. There's no special treatments, okay? Whatever you do, you want to talk to your doctor. You've got to let them know. We had somebody who went on one of those fad, that wasn't fad diets, but it was back then. It was the beach, Atkins diet or something,
Oh, yeah.
South Beach or something.
Yeah.
They threw their electrolytes so far out of whack, they wound up in the hospital. You know, we've got nausea from our treatments. We're sick. We're throwing up. We need to worry about our electrolytes. Pedialyte is wonderful to keep in the house. Protein shakes are good to keep in the house. You want to do small little meals throughout the day. If you eat that big meal, you're going to be miserable. You're not going to be able to breathe. And if it comes up, it's not going to be pretty. Correct? So based on that, you want to keep your healthy plate. You've got your vegetables. You can buy those plates online. But I think that anybody who goes through, you know, we've got a nutritionist there. We've got a patient. We can set up one-on-one with our nutritionist. They are also a very dynamic part of our team. Because if you need calories, you know, some people have to have calories. We've got to find a way to do that. So there's certain milkshakes that you can do. Honey is wonderful. If you need calories, honey's good. Well, I brought it here. You can take a banana, and I meant to bring that PowerPoint with me, and I forgot to bring it. Then that 70 and 90% dark chocolate is full of potassium. That's what you tend to lose when you get sick. That's when you get the muscle cramps in your legs. You need that potassium. You can take a banana. You can take a couple blocks of that dark chocolate and you can grate it over that banana. Then I can throw a scoop of ice cream.
Oh, gosh.
Okay?
That sounds good.
You got your dairy component, right? You've got 3 good things there. That's not a heavy meal that's going to make you miserable, and it's going to give you a lot of nutrition. Correct?
I'm sold.
Yes. Yeah, and I meant to bring that for you, and I forgot. Cancer treatments, chemo, anything, even COVID, it affects your smell and your taste. Things start tasting metallic. Correct? So there's certain things you may say, I can't do it. That's okay. Hopefully, after everything's finished, you're going to get some of that back. Find out what makes you happy and then keep plenty of it in. And it may change next month. After your 4th treatment, it may be a whole different story. Okay. Foods to avoid, of course, are your spicy food. This kind of was a thumbs up and thumbs down. We want to stay away from the pastries. We want to stay away from the processed foods. High sugar. You do have diet. We'll let you have your diet. Okay. And acidic foods. A lot of people don't think about orange juice. It's very acidic, grapefruit juice. And if you're on certain medications, you shouldn't you shouldn't even drink grapefruit juice to begin with because it's a total contraindication. So, foods that fight inflammation are going to be your veggies. It's going to be your healthier fats, your avocados. Don't know if everybody likes those, but if you can eat, they're very good for you. It's a good fat. And then, of course, you've got your lean proteins. And then water. You need to stay hydrated. Your secretions, if they start getting thick, you're not drinking enough water. Caffeine will dry you out. Carbonated beverages will dry you out. There's caffeine. It has a diuretic effect, not water. Buy some of those little drink mixes you can put in here. You know, you can put all the different things, flavors in here. If that's what you need. Cucumber water is excellent, and it's got some extra little goodies in there for you. Try to do the smaller meals like we talked about. It may help reduce some of the side effects. Okay, any questions? I don't know if y'all can read that, and I wish I could print this and I may just send it to you, but it kind of breaks it down into each little section there. If you can read that fine print, it will tell you some of the good things, but your whole grains are really good for you. Working with a dietitian throughout, during, or after. Anytime you have a problem, do they weigh you every time you go? Perfect. So they see that your BMI is getting too high or your BMI is getting too low, which is that body mass index. You know, that goes by your age, your height, and your weight, you know. Then they're going to make sure that they get you to a nutritionist. And there's a great one, depending on where you go. The Stick Center's got a great one. over there in the stick center. She's awesome. And then again, you want to eat good vegetables. So don't you love how little peppers come down, those little tomatoes, that's your trachea coming down, see it? So. Now, the biggest thing to remember is if we cannot breathe, nothing else matters. That's right, nothing else matters. Pulmonary rehab, we take a subject every week, and it's 45 minutes to an hour worth of education. And so trying to squeeze everything in, this is actually like 2 of my education sessions. And I tried to pick out what was the most important thing. Energy conservation, breathing retraining. They're game changers. You all look like you all have a great support system. Practice this every time you have a session. Make sure they're still doing the personal breathing correctly. Okay. Any questions? Any questions?
I have a prescription for a neuro.
Okay.
So is that like commonly used?
Yes.
What is that?
And it's very expensive. A Nora is, you can correct me if I'm wrong. This could be a test question, you know, what I'm taking, why I'm taking it. It's a preventive medication to help you with breathing. It's a preventive. You just take it once a day. Don't matter how you feel. Don't matter if you're good or bad. You just take one puff and make sure, person, I feel like that. But then you're taking it incorrectly, and it is very,
So it's an inhaler, once a
no,
day.
well, it is, but it doesn't look like an inhaler.
But I mean, I'm saying it's
yeah.
not a pill.
No, you inhale it. As a matter of fact, it's like powder.
It is a powder. It's what we call an elliptum. And they're game changers. You see the Anoro, you see the Brio. Okay.
Uh-huh.
So they are maintenance medications. So basically what happens if you're having to use your albuterol several times a day, we all know these things are going through the roof now, correct? So the maintenance medication is exactly what it's meant to sound like. It maintains your breathing. So they are very expensive drugs.
Yeah.
It is a powder. It is one of those drugs that you've got to have a good inspiratory flow. You've got to be able to go, okay?
Yeah.
If you cannot go, then those dry powdered inhalers are not for you. We measure that when you come into the program to make sure. Otherwise, it's going to sit right here.
Are you talking like Brio, like that?
The Brio, yes,
Brio?
the Brio. She was asking about the Anoro. Those are new to the market. They're maintenance medications. The Brio, yes. You want to make sure you rinse your mouth after you use that. Do not, and I mean do not store them in your bathroom or your kitchen. Inside that, as you turn it, the powder will actually get very hard as moisture gets in there. You want to make sure you wipe your mouthpiece off after you use it before you close it. The other thing, a lot of people, you've got to learn to be your best advocate. My medication is I get 90 pills every 90 days. You get 30 doses. What happens when those doses, and there's 31 days in the month?
It finishes?
Sometimes your insurance will not let you fill it.
Won't let you refill it because it's before.
It's
the-
before the time. Some insurances are getting really tight. Sometimes you've got to remind that pharmacy tech that says, well, I'm sorry, you can't fill it. Well, you know, there was 31 days, 2 months in a row, and I'm out of my medication. If you don't have the maintenance medication, it's not going to happen like that. But you are going to, it takes about 7 to 14 days for those to actually get in your body and work. Okay. You know how steroids, if you stop taking them, you kind of get that rebound effect. You just don't want to go back to baseline and have to work your way back up. Great question.
Thank you. You made a comment that it shouldn't be left Like, I need mine on my dining room table.
Great place.
So I could remember, my brain sometimes don't want to remember. And that way I will always, every morning, I always sit at the table and I will. remember.
That is a wonderful place to keep
Okay.
it, but don't put it in the bathroom because of the humidity,
Okay.
and don't store it in the kitchen because of steam off the pot, when you're cooking. Because if it gets in there, it's going to cake it and it's not going to come out. Once you take it, it's got the little wheels there on the side. You don't want to put your hands over those vents because you're not going to get the flow of the air to bring the medicine into the lungs. If you get sick and if you wind up in the hospital, after your surgery is not the time to be on any of those dry powdered inhalers. You probably don't have the strength to go. And if it's not, we measure that flow. It's got to be really hard. It's got to be really fast. It's going to sit here. You've got to get it to the lungs. I've got some people that take 2 puffs of their albuterol before they do it. They want to open themselves up to maximize that medication to the
So
lungs.
how do I know if it gets to the lung?
Do you taste it in your mouth?
No?
Good. Then it's probably getting to the lungs.
I
You just
mean-
want to tip your head a little bit.
Okay, yeah.
Think about how you're lined up here. If I go just like this, it's going to go right into the back of my throat.
Okay.
If I tip my chin up just a smidge to get that alignment. Now, websites, there's all kinds of websites. You can go, and I know you may or may not have COPD, but go to the COPD Foundation website. Okay? They've got tons and tons of videos, educational videos. You can click on that. American Lung Association is another one. Now, they don't have as many of the medications. We see that more with COPD because if they don't do them correctly, you can also usually go to the manufacturer's website. Okay, there's some good YouTubes out there, but not all of them. You've got to know how to use it correctly.